Welcome back to The Business Experience Show, where you can learn from others' experiences and successes in business.
Welcome back to The Business Experience Show. We have with us Dr. Alinaghian, better known as Dr. Ali. Dr. Ali has had an optometry practice in Orange County, California for the past 38 years when Irvine was mainly orange groves. Imagine that. With changes in medical licensing, insurance, and technology, he has seen it all. Welcome, Dr. Ali.
Thank you very much for having me.
I know you don't mind if I call you Dr. Ali, as many of your patients do. Please tell us about your business background.
Well, I graduated back in 1974, and I've been, as you mentioned, I've been in urban area, Orange County, since 1974. I've been in many different aspects of optometry business, basically regular optometry. Then I always loved to do teaching, so I took 1 year off, and I was doing a optometry school teaching for about a year, and I had to get it out of my system. Then I went back again. So I've been in basically private practice, I've been in HMO type of practices, and then the teaching part of it stayed with me because I do work with the children's kids, high school kids, grade school kids, basically teaching them through the optometry how to do their work, school work, sports, later on driving to improve it.
So 33 years you've been in business. You have seen business change.
My business has changed tremendously because when we finished school long time ago, after about 20 years, it really became kind of very monotonous because it was pretty much the same thing over and over and over again until some kind of state law was passed back about 20 years ago that allows us to go back to school again. And not everybody did go back to school and get a licensing to get a medical optometry to be able to use all the medication that you need for the patient, so we don't have to.
Did you know when you were young you wanted to go into optometry?
Yes. Well, I was going to say always, but it's pretty much true though, because when I was younger, when I was 2 years old, I did have an accident to my eye. So between about age 2 and 14, I was in and out of the hospital. So by the time I was 14 years old, I had no other choice because I knew everything about the eyes. Awesome. And so I have all the experiences really that patients go through.
Right.
And I have gone through about the surgeries.
Have you seen changes with insurance, and has that impacted your business over the last 20 or 30 years?
Well, unlike some of my colleagues that they do complain, I don't complain because basically when you go into the medical part of optometry, most of it is really the insurances.
Right.
So majority of our patients are basically coming, a good, I would say 70% of them are from the insurances. The rest of them are pretty much from the referral from the patients and other doctors, though.
You talk about before the show that there's a percentage of people that need vision training, and you also assist with learning disabilities. Can you share with our audience about that?
Well, learning disability that you hear about ADDs, for example, a lot of medical treatment. Through our program, there is no medication used for the ADDs.
And that's correlated with optometry? I didn't know that.
Not too many optometrists are doing that. I was one of the privileged ones when I graduated way back in 74. I took 1 year of residency in the learning disability and vision training. So after that, basically, it phased out of optometry, but I have kept it. And I do practice at Kaiser 1 day a week. And I do see kids who have learning disability vision training. And
you have literally seen thousands and thousands of patients.
I would say I probably have seen more patients for vision training and learning disability than anybody else in the country because I've done it for Kaiser also for 33 years.
Dr. Ali, is that something that you've done over the years with your experience and as technology's changed and you've seen it? Is that how you created this educational program?
Well, the technology has really changed, thank God, to the computer and internet. With the vision training, for example, we used to have children come to the office once a week, or maybe 50 times in 1 year. So they had to pull them out of the school. The mother had to bring them in. But now with the new technology, we don't really have to do that because the programs that we use, in place of seeing them 50 times, now we're seeing them probably about 3 times. And we are interconnected, and I know exactly what they're doing at home, and then we do communicate through the internet, through the email, to the same program that they're using.
And doctor, is this just for learning disability, or does this enhance sports, or can this be beneficial to pretty much anyone to strengthen their eyes?
Anybody can use that. majority of time use them for the children at school, but they can be used for sports for anybody, for the reading, even adults. Going to the speed reading. I get kids who are in maybe 5th grade reading 3rd grade level.
Wow.
And then all of a sudden they have gone to 8th grade level, and they can really improve. I have kids 7th grade level now reading at 12th grade level.
Well, how do you get the message out to let people know that they might benefit from the services that you offer?
Well, basically through our patient we talk with. My practice is basically pediatric optometry. I do see adults, but majority of no kids. So I have had kids who have seen them since they were 5 years old. Now I'm lucky enough they come in with their own 5-year-old, and I have one who's 35, and he's been coming every year. Now he's been bringing his kids. So it's really optometry is just seeing 20/20. A lot of people have 20/20 vision. They still have a lot of problem seeing things, which is kind of hard
How do you know when you have a problem?
They don't. That's a problem. That is a problem.
And most people
They
probably don't
know.
get a checkup.
I would say I get at least one 16-year-old every week.
Wow.
Who went to get their driver's license and
Okay.
they didn't pass. When I checked them at my office, they were actually
It had to do with their vision.
legally blind that they didn't know.
What's legally blind?
Legal
20
blind
what?
is a word 2200.
Okay.
2200.
I
You
used to
can
be
see.
legally blind.
And you also have kids that can't hit a curveball, but they could if they would get this training, and they don't know that there's a problem, or the people that are branded as being slow or stupid because they're not tracking properly, and there are exercises they could do to get better. And if all you're doing is waiting for referrals from word of mouth, there's more you could do. You must know that.
Well, no. Every kid who comes to my office is not just a regular examination now anymore. We go ahead and put them through all the
Vision.
What are the school systems doing for this type of problem?
Well,
Because it has to be something that we've learned that
I
is
remember
a
being
problem.
in school, the nurse checks your vision, and if there's a problem, they let your parents know.
Well, they check your vision with an eye chart, and they'll listen to hearing, and they'll do the tones, but there aren't tests that they do at school that determine whether somebody is properly tracking and whether your exercises and your services might be of benefit to them, right?
Well, I think it's a disservice if you don't take your child to the eye doctor or optometry. And I'm speaking personally. I needed glasses since I was in 1st grade, and I didn't get them until the 4th grade. So
and you probably needed them beforehand.
I'm an advocate. Take your children
But here's
get
what I'm
advice.
saying about that. It's like there's a system and a training, and Dr. Ali's talking about he has a training method, and one of the distribution systems for him is the schools with the kids. If he could get that training into the school systems and have vertical markets, I mean, we've got 50 million kids nationwide that needs to have all types of training, and I love this. I wish I would have had it whenever I was in elementary school.
Then maybe you would have been able to hit a curveball.
Yeah, it might have been over 350 in my batting average.
But 15% of the kids do have problem with the school. If you go to the school and you see the people in the last row, those are the people who are going to throw papers at other people. These are the people who have good vision because they're sitting in the last row, but they have not ability to use the two eyes together. They don't have good focusing, they have no good depth perception, and sitting in the classroom is really miserable for them because they can see better out there than in here.
And they don't even know they have a problem or what their problem is. And as Cole was talking about, if there was a seminar, if there were articles, if there was a way to get the message out, then parents who love their kids would be more proactive. They would get their kids tested, and they would get take advantage of the services that you offer, and then you'd be able to help these kids. How do we get your message out? That's the question, isn't it?
That's a problem. You really can't, except through the patients I see. When I see a patient and sits in the chair and I do examination, before the mother says anything, I can tell them what the problem with their schooling is, and they all look at me funny. How didn't I say that? Because I know you're really sometimes they've
been with them every day.
That's how it is, though, And then the best part is when we do evaluation, which is all computerized. It's not my saying so. They can see it. They can see how the eyes
data.
are working. They can see how the eyes are focusing, and the best ones I have are these. The mother comes in, and the kids having problems at school, and I know. So what I tell the mother, I'm going to free you from doing homework. And they are so thankful because that's what they do. The parents are doing a lot of homework for the kids. And with this system, Now the kids are responsible to do them, and the parents get really free from doing other stuff though. And most of the time, the best patients I have, I hate to say that, are the kids who say to me in the office, you know, I'm stupid.
Right.
Okay? And I explain to them,
No, you're not.
because these are the conditions you have.
If they don't know what looking,
but they think they're stupid. Yes, definitely. Yeah.
Here's a couple of things, Dr. Ali, I'd like to see for you to implement for yourself. Number one is all the testimonials that you get from patients, as long as their parents will let them talk about those kids. I mean, there's a lot of things that happen to a kid when he feels stupid, or he feels like because he can't do something that it makes him withdraw in the education or in school around his peers. Is if you can create a series of videos both on testimonials, two on some of the things that you do just for yourself, put it on your website. Now let the parents in the audience or the people that you know or send emails out, let them go to your website and let that teach them and train them. Duplicate yourself on there. I'd like to see you do that. You got a wealth of information and wisdom.
Well, on my website, ocvision.com, I do have some information about how the eyes work. It's not just the vision, you have to really know. So there's some on that one. But I have found that right now at this point is really word of mouth, because when I get one patient, I get another one from the mother telling somebody else. So this is basically. If you could
increase your business, would you be interested in doing that?
I would love to do that full time.
Okay.
It's really that's why I go to Kaiser. I see about maybe 20 kids when I go to Kaiser, and one after another, and I have every happy mother and father who leaves my room.
Dr. Ali, are other optometrists doing this? Do they provide the same services that you provide in terms of the tracking and the training and the corrective work?
Unfortunately, most of them don't, unless they're pediatric.
How do you get the word out to the other optometrists? I recognize that some may be your competition, but how do you? Let's save the world. How do we help?
Yeah, and Dr. Ali's had
how do we get the word
experience.
out?
Right.
I want him to be number one when you search for Google Irvine Optometry, Dr.
That's
Ali.
what I should be. Yes, I know I should be there.
That's easy enough, but let's spread the information about how to take your knowledge and help you train other people to do what you do and be compensated for that.
I do get some of the new graduates that they do come to the office and they do some training with them because they're interested. And I really think this is going to be the way to go for kids who are having problems in school.
Right.
But it's not just the problems with the kids. There are so many kids that could benefit from this. I mean, you talk about the 15% with learning disabilities, but I would think that pretty much any kid and any adult could benefit from the training and the programs that you have. Getting the word out to the patients, getting the word out to other doctors, getting the word out to the world that there's a problem and you have a solution, and figuring out how to get that solution to the patients. And like I said, let's change the world.
What percentage of the people have eye problems, would you say, Dr. Ali?
What percentage right now? 66.
66%.
I mean, the vision problem. I'm talking about the whole
66,
thing.
yeah, I believe that.
Majority of nearsighted.
Wow.
And number one cause of nearsightedness for the kids are the little telephone.
Okay.
Cell phone.
We're going to talk about that when we come back. We're going to take a quick break for more information about Dr. Ali and our show. To learn more about any of our business guests, go to thebusinessexperienceshow.com. Follow us on Twitter. Ask us to follow you back. Go to thebusinessexperienceshow.com. I'm Lisa Caprelli with Cole Smith and Doc Kramer. You're listening to Angels AM 830 KLAA. Don't go anywhere. We're talking with Dr. Ali. We'll be right back. Are you an entrepreneur who would like to increase your business by becoming more recognizable in your field? Ever considered authoring a book, being on radio, or strengthening your brand, but you haven't yet? Hi, I'm Lisa Caprelli with the Business Experience Show. I can help you remake or revitalize your professional image in ways you only dreamed about or never imagined. Through business, marketing, and networking, I can show you how to put the passion and fun back in what you do. Visit goglossy.com for a free consultation. I would love to help you achieve more. Visit goglossy.com.
Welcome back to the Business Experience Show, where traditional business practices intersect with outside-the-box thinking on the road to success.
Welcome back to the Business Experience Show. I'm Lisa Caprelli with Cole Smith and Doc Kramer. We're talking with optometrist Dr. Ali. Dr. Ali, what age would you recommend people take their children to be seen by you?
Any child should be seen at least by age 3.
Oh, okay.
Okay. If you look at a kid who's about 6 years old, you look at their face, they have the biggest eyes. Okay.
Right.
The reason they have really big eye, these are the adult size, adult developed. Everything is supposed to be made in them is pretty much made by age 6.
Except the nose and the ears, they keep growing, right?
Exactly. But if the vision hasn't been developed in the eyes by age 6, glasses, contact lenses, surgery is not going to correct for it later on. You have to correct it before that. So we have a lot of times between about age 3 and age 6 to develop the vision.
Very important.
And this is called amblyopia. Once the amblyopia sets,
That's
the
it.
vision doesn't develop. And the problem with that one is only affects one eye. It doesn't affect 2 eyes. So parents don't think about it. The kid doesn't say because they can see through 1 eye.
Right. They think, that my child's fine.
So that has to be corrected before age 6.
And how do you get the word out on that? Because as a parent, and I had 3-year-olds, and if some doctor told me I needed to go for an eye exam or to take them, I'd think, you're just trying to sell me. You know, some medic is going to charge me money to bring my kids. 3 years old, they're not old enough to read. How would they even know that there's a problem? Actually, my kids were old enough to read at 3, but not everyone has.
No, as I said, I get 16-year-old kids who are not complaining. Kids do not know they have bad vision. They can have 20/80, 20/100. Yeah, because this is the vision. But usually when you correct them and they lose 1 line on the chart, now they know because the brain knows what's supposed to be there. Okay, so kids not going to complain. So the first time should be age 3. If they have amblyopia, within 3 to 4 weeks, it can be corrected. You wait until age 7, you can't do
But Dr. Ali, you said something interesting during the break, and that was the telephones, the smartphones, where kids now they're nearsighted because of the phones that they're using.
Very much so, yeah. Majority of nearsighted people right now are about age 5.
Wow.
Because the parents are giving the cell phone, and no matter where they go, they're using the cell phone, and that causes problem becoming more and more nearsighted. And eventually, when they look away at distance, the vision is not going to be that clear, and they will lose that.
What can be done?
What do we need? Bigger phones?
No, not bigger
tablets?
phones. Farther away phone, not the closeness.
Longer arms?
The longer arms, exactly. Yeah. So what we normally do for people like that, we normally use them, put them in the pair of glasses for the close work, okay?
Dr. Ali, so
Yes,
much good information. I'm sorry to interrupt you.
That's
I want to
okay.
get in. If someone wants to follow your footsteps, what advice would you give them on what to do and what not to do? You've been 33 years in business, optometry. You're here in Irvine, and you've done many projects like Project Look, and you've been to Mexico. But let's talk about what would you give someone advice on what to do and what not to do in business?
I compare the optometry license to driver's license.
Okay.
Just because you have a license, you cannot drive. It takes few years at least. My first son took about 3 cars before he could learn how to drive. Okay. Same is true with the regular, any type of licensing.
Maybe he would have benefited from some of those eye exercises.
Definitely, yes. No, he was going too fast, by the way. No, my advice is after they finish school, don't go open up an office. Go work with somebody else. You have to learn the side of the business because nobody is taught at school right now about the business part of the practices. And you just get out and you don't know what to do. So definitely need to have somebody teach you. And it takes about a good 2 years before they really understand what they're doing. They know the knowledge, but how do they work it out? How do they talk about it? How do they implement all these things? It takes the time. It takes time, though. Yeah.
It's said that it takes about 10,000 hours to become an expert at what you do.
Right. I heard that
And
with
the
the
2
Beatles.
years getting started is not 10,000 hours. That's just getting started.
It's good to start. Yeah, even going to school is not going to be 10,000
That's
hours.
right, that's right.
That's what they call in practice. You're always practicing
That's
to get
right.
good at it, though. Yeah.
Thanks
Very
for being with us today. We got to wrap up this show. Thank you for being with us. Any last words you want to share with your audience?
Well,
right.
thanks for having me.
Yeah.
But
It's been
again,
a
don't
pleasure.
forget the 3-year-old ones. Those are the important ones.
Dr.
Thank you.
Ali and Ed Personius today. Thank you for listening. Have a profitable week. For more information or to reach any of our guests, please go to thebusinessexperienceshow.com. Follow us on Twitter. This radio show is produced by Brian Gaps. Theme music by Mike Werner. Production assistant Ben Burke. I'm Lisa Caprelli. Thanks, Cole Smith and Doc Kramer. See you next week on Angels Radio AM 830 KLAA.